Brain metastases are a common clinical problem. Every year, 300,000 or more patients will be diagnosed with brain metastases in the United States, and we are increasingly seeing more of these patients in our clinic. In the past, the treatment for these patients had been limited only to surgical options or radiation-based treatment options, albeit whole brain radiation or focused forms of radiation, because our traditional chemotherapies do not penetrate the blood-brain barrier. That's the lining that encompasses the brain. However, this is changing with more recent developments of targeted therapies that are small molecules which have a better blood-brain barrier penetration, and also more interestingly, with the use of some of the immunotherapies now which are showing very fascinating results in brain metastases. So there are a number of targeted therapies which are now showing initial signs of promise in brain metastases. So here at ASCO 2017, I'm excited about some of the abstracts which will be presented in lung brain metastases, breast cancer brain metastases, and melanoma brain metastases. So in lung cancer, we are seeing drugs like alectinib, which is a targeted therapy against ALK, which is showing excellent blood-brain barrier penetration, and the results of that will be presented on Tuesday. We are also seeing interesting results with neratinib and capecitabine combination in breast cancer brain metastases, which seems very intriguing. We also have abstracts which are going to look at a combination of dabrafenib and trametinib in brain metastases with patients with melanoma, which looks fairly promising. So traditionally, the thought process was that the immunotherapies would not work in the brain because brain was felt to be an immunoprivileged site. However, we know that in recent times that is not true. So there are a number of abstracts which are being presented in immunotherapy which are looking extremely promising. The ones which I like particularly are the ones with melanoma brain metastases, where combinations of nivolumab and ipilimumab are showing very impressive response rates in the brain, which are very comparable to the rest of the body. Now this is something which we have not seen in the past. So this looks very intriguing, and I think will change how we treat our patients with brain metastases who have asymptomatic disease with treatment of checkpoint blockade for these patients.